Because I'll forward another one. So you can actually, if you can find those.
Yeah. Steve, that's how I myself. We just don't get it. Like, it's all set. Not.
So I really feel like might go out and talking to their friends out there.
I love
that. Right, people may do that. So everything needs to get out. Otherwise, it's just very.
Not that you guys are.
Where's 9101?
Nice to see you, Mr. Lord.
Two.
Oh, we don't have.
Those watching via Zoom, can somebody come to 9101 next? Supervisor, we need one more supervisor.
Yeah, she's 7440 right after.
Is it a 786 number? Or a 409?
No.
Is that new,
9101.
Do you see Luann?
Yep.
Okay, I say, I had a conversation with her, she said she was gonna zoom in.
Yep.
What was that?
It's the new redistrict.
For the most part, yep.
Is out of town.
Gallivan's out.
Right, you don't have Gallivan.
Who's this guy?
Farella?
She's at the.
He's nice.
public-
Is he?
Is that what she's doing? That is what she said.
Republican,
So, yeah,
he's a nice guy, his district is kind of
Oh, it's
laid back,
Jerry.
he does his thing, you know, he's not
9101 is
not
Jerry.
aggressive, or he doesn't, he won't take any.
Jerry Davis, are you out there?
And
Are you on
So-
you?
he's kind of the baby kissing hand, I'll just do his happy
Okay,
moments and stuff, but he's a good guy.
got it. All right.
You know, Orton, Gallivan, and those guys will stand up and do their, they'll
Yeah.
call people out, and Rillo will stand there with them, but he's not the one that's
So
going
is
to say
he. I
anything.
mean, she's
Right, yep.
pretty good, yeah.
Helming's good. He's a great guy. And he'll do, like, if you call him for a problem with the town, he will bird dog it and handle it and all that. He's just not one that's
Not
gonna.
a territory.
Yeah, well, it's Allegheny, Cattaraugus.
Sure. How many people were we thinking that for the staff force?
Between 3 and 5, probably to set the task force to see the parameters of the funding that's coming in.
Oh.
And, you know, to see what.
I should get my agenda out, huh? Oh, I'll volunteer if you need me to.
Is Vanessa on?
I'll volunteer if you need me to. Ask questions and get stuck in something, you know. I should-
You've had Jansen on the last one.
Yeah.
I think you're on that in this one.
Oh, yeah, I'll come, but I'm not like.
I think this is for her. I thought her was-
So how would this differ from the tobacco?
He's
tax?
gonna sing.
How would it differ?
No, no, not at all.
Not yet, anyway.
And you probably, I'm looking at, Jen, you can probably talk a little bit more about the money coming in, but it's not like bonds, like the
We don't know
tobacco.
yet, because we know that it's coming.
Right, and I think the amount is like very.
They don't, right, we don't have the amount, we don't have the parameters, but I thought it might be a good idea to at least start talking about it so that, you know, we are ready when we do get that information.
I had read that we may be restricted in terms of how we can utilize those funds. They have to be used for specific purposes. That is correct, okay.
That there will be some sort of.
The parameters.
list.
And I
Okay.
feel like for Wyoming County, when I was doing, early on, when I was doing some quick math, it was gonna be maybe 100,000 a year. I mean, not like huge, it's not gonna be like $2 million, but it is over like 20 years.
Is my understanding.
Yeah, I mean,
That's,
I feel like it's,
I know, before the tobacco, when, there was an option to take it all or to take it over
Yeah.
a period of time, to take it all, I think. I'll talk about. But did they want to say president?
I think it's gonna be painted, is it?
it's my understanding it's gonna be spaced out. over-
yeah, it's not like that. It's not like, well, you can take this month and back. I mean, they can change it anytime they want, but,
And the most recent paperwork is, they're still asking for stay and all that stuff.
Yeah.
But then, so, that's the most recent stuff that they accept. So there's no actual numbers and timeframes at this point.
so is it premature then? I mean, what are we gonna meet, talk about?
If we set up the test, if we just set up the membership of it.
Oh, okay.
Then
Not meeting.
to be determined.
Alright.
So it will serve getting more information out. But at least we got.
Just the core people to keep up on it, maybe keep informed.
So right now, Cheryl's already got Becky, Cheryl, me, Chair of Finance, Janice. Anybody that wants to be on this?
You're probably should.
We'll leave it at 3 for now.
Okay.
Oh, yeah, everybody's there.
So now.
There.
Did you hear that, Jerry? Testing.
You gotta show up, you wanna stay up.
You're gonna be the president of the opioid task force.
President.
And Jen mentioned, that is get into it to invite people and share, and, to get different input.
Right, depending on what the restrictions are, we may find to stop the mental health or the sheriff's department or whatever.
All right,
So we got,
more for future.
is Jim Rick? Is it Jim Rick?
I think Ron,
Oh, right.
do you want to be?
Yeah, okay,
That puts you at 5.
okay.
You want a motion on that?
No, you can do that, Mr. Chairman.
Just like your, cool.
All right, I have a bunch of renewals for today, so I'll walk through one at a time. First thing on the list is a renewal for Civics Plus, that's our website. It's just a yearly annual maintenance, but it did go up substantially from last year, almost $1,000. And as I go through this list, a lot of prices went up big time this year, more than anticipated. I kind of anticipated like under 10%, and we're seeing things like as much as almost 30%. So there's big jumps. The first one is for Civics Plus. I have no issues with the website. In fact, I think it's been really good. And actually, we're going to be due for a refresh with that too. So when that time comes, basically they can just clean it up a little bit. They'll go through any links. They could change basic colors and stuff, and it's included in our agreement. So just one more bonus, which normally that would cost a substantial amount of money if you wanted to refresh your webpage. It's cheap, but it's not cheap. So
Is the webpage part of what we had talked about before, the intranet?
yeah.
Is that the same, would be a
Same company.
same thing?
Yep, so we can have an intranet with Civics Plus as well. And that would be more like for us to use, not a public facing webpage. Yep.
Which might be a bad idea considering we have some off-site departments that don't have ready access and some things.
Right.
And, we try to get the public directory updated to those off-site departments and that doesn't always work out well.
Yeah, I have a new solution for that.
Okay.
So,
I don't know, I feel like that's something that's been a project that was talked about for years and years.
yeah, I guess the big thing is with the intranet, and I'm not trying to, get us off course here. But it had to be like a really good use case, because everyone's gonna have to log into it, it just,
Oh, it's not like a thing
it would be, it's just like when you go in, if you were to edit the treasurer or the budget office page on yours, like you log in. And I don't know if you've done that, but we can all, like, departments can access their version of the page and update their own, if they set that up long ago. So, yeah, and that was part of this website too, is some departments do update their own pages, which is great, instead of solely relying on us for everything. I mean, we do major changes, of course, but. So,
Sorry.
no, you're fine. Yeah, the internet is a thing, it just be a matter of figuring out what we want to put on there.
That's more though, that's part of that. Right?
Yep, and actually, one thing that we talked about with that, and kind of tied in, is the GIS committee. They want to have like a intranet shared page for all departments so that we can see all the layers. If you guys sat in on those meetings, they talked about that, and that's how we're going to do that. It'll sit behind a password protected page, and then they'll be able to access that. So
Bill,
the intranet.
have we ever considered creating a Facebook page for the county?
We could, and some departments do. I know the sheriff's department does, I know emergency services does, I believe the health department does, the historian does. A lot of people do. The big thing is, if you're gonna assign someone or assign that page, someone has to manage it.
I'm afraid we're missing a significant part of the community that utilizes Facebook and for various exchanges.
Sure.
And I agree that we would probably need an administrator who can manage that, but Facebook is the medium, that people are using.
Yeah, and if you go down that route, then you're also looking at probably going on Instagram as well. Like that's a really big one.
Sure,
Depending on like what age group you're looking for,
right.
they all have their own, right? Like my generation and slightly older is probably the Facebook. You go younger than me, like if you're in your 20s, you're probably more in the Instagram. Like each kind of has their silo of how they get their social media.
When did you get to be an
I know, right? It's terrible.
Well, I mean, Twitter, Twitter is a great medium too for communication and,
Sounds like someone wants to be in charge of social media.
Right.
No, yeah, and I guess.
oh, yeah.
Chairman, you could do a nice TikTok.
Yeah, no, a lot of departments are doing that, and they are pushing out certain things. I know the sheriff is pretty active with this, as well as emergency services.
Who manages his?
He does. Greg does.
Greg does.
Yep,
He manages his Facebook page.
yep, and I believe Brian does his own as well.
Sure.
Yep.
I mean, it's a good way for him to kind of keep a pulse on the community.
Yeah.
So what's going on? Sure.
We run a LinkedIn page.
What, I'm sorry,
LinkedIn.
there's a link on the county page to the sheriff?
LinkedIn.
Oh, LinkedIn, yeah, right. I mean, you could advertise positions on a Facebook page as well.
Correct,
Costs us nothing.
correct. And the hospital has a Facebook.
There's just legal ramifications to that. I'm not sure. I know it on our, for the assemblyman, we have to allow public comment on those things. And sometimes they can get vulgar and argumentative, and you have to have rules and things like that.
Oh, yeah.
After the whole debacle from the previous president, there was no, you can't delete or ban without certain.
Sure.
So I mean, we'd have to have someone very willing to go through the muck and mire to keep that updated. But it's where everybody gets their info for sure.
Too bad.
Going through
Sure, you want me to just go through? Yeah.
the.
Okay, yep, so number 2 is a renewal for our Viper endpoint security, which is our antivirus. I don't have an official quote on that, so I think the amount that I have on there, 7,500 should cover it, but honestly, I'd like to just say 10,000, so that way if it comes in just over, I don't have to bring it back. I'm hoping it's well under that number, but I don't wanna have to bring it back next round, and then it's due in March, so. We could do that, and then I can bring it back what it was next round, if you guys are interested, so.
Yeah. As long as he brings it in under, and you know, but then the resolution.
Right. So number 3 is another contract with SHI. This one is for our Barracuda email security. Basically, every piece of email that comes through or comes into the county goes through this device, and it gets checked for certain things, whether it's spam or malicious code, or it's just an extra layer of security that we have. I mean, it's a necessity. So. That one, and number 4 is a contract for Real Vision software. That's like an image based software. Records is the primary user. The district attorney has access to it. They don't utilize it as much anymore now that they have a new system that can do a similar function, and DSS uses it as well.
Motion by Supervisor Tucker for 1 through 4. Discussion on these.
Bill, how's that gonna affect your budget if these things are up, like you said, 30%? You're gonna have to appropriate some money to it.
Yeah, I think we're just gonna be in trouble, honestly. And we've had some issues with equipment. I've been working with the sheriff's office. I had a couple weeks ago, we had an issue with a physical box. And I had budgeted to replace one of those boxes this year. It's something that we talked about with virtual infrastructure last year. But the box that had an issue was not the box I planned on replacing. So that's another additional cost. After talking with the sheriff and Tony Santoro, they might be able to help me with one of those boxes, which would be great. So I'm exhausting every avenue we can to not go over the threshold, but honestly, I don't know. It's, yeah, you anticipate like 80, 10%?
Well, and they're kind of like the buildings and grounds where their maintenance, they plop a bunch of money in it. They know, it might not, you know, 1 year you're gonna spend all this money on this thing. I mean, it's there because that's what you're using it for. You're buying stuff or paying for stuff that, you know, it's a big pile of money.
Support for This American Life.
So it's not like every dollar that they've got in their budget is accounted for. They have a lot of money that is flexible. And that's why we
Like
have
a
that.
contingency.
Well, it's just, this is how much we give you to spend on things that arise, you know. So,
Yeah.
but I mean, yeah, I mean, if
So,
we run out of money for whatever reason, they come and ask for it.
Yep. Yeah, some of the numbers were a little shocking, honestly. 30% is insane. Oh, sorry, yeah, not done.
and we're discussing items 1 through 4. Motion by Supervisor Becker. All in favor?
Aye.
Opposed? Carried. All right, number 5.
Okay, so number 5, and Cheryl can correct me if I misspeak here, but I think we had 2 resolutions for the same thing. So we're just looking to rescind resolution 21-125, because it's also covered by 21-330. Is that correct, Cheryl? Am I saying it the right way?
I believe so, yeah.
Motion by Supervisor Jacoby. Any discussion on this? All in favor?
Aye.
Opposed? Number 6.
All right, number 6 is to extend Avenue Insights or ACS or whatever we want to refer to that as the old financial software. We're still working on the HR and payroll modules, and we're still not even done really with support on financials if we need training and things like that. So I have it going out 2 months only because my newest timeline with Unis has us running. Sheets of paper messed up. Has us running our like parallels in May. And the last go live in June, so that would definitely spill into the next quarter. And honestly, I know that, I don't know Jen's workload, but she's got some big payroll she's working on right now. So I'm pretty sure that's shifting focus away from, and I don't want to misspeak here, Dan, but I know she's got a lot on her plate. So I'm sure that's not helping.
We're going to try to work aggressively to meet that timeline as we possibly can. To be absolutely candid with you, my expectation that we're going to meet a timeline in June is 0.
This would carry us at least until September.
Yeah,
Right.
I think September might be a more realistic timeframe. Maybe we'll get lucky, but it's where our priority is making sure that people are being paid rather than unison implementation. I think that's a good goal. Yeah. Yeah.
July or August.
We don't want an insurrection on our hands.
Should we be looking to give you some temporary assistance there, or?
It's not a matter of temporary assistance, it's a matter of the days that the Munis folks have offered up as liaison days. For example, last week, the day that they wanted to pull Jen out to do an all-day session was the day she was loading payroll. So I told her, no, do payroll. Which I think we would all agree is the right decision. Munis, their representative is allotting about 2 days a month to work in conjunction with folks.
And then we said, so I remember we had that same issue, and that was part of that letter that we wrote, right? Because just because they couldn't offer us assistance on, it was sporadic and it wasn't conducive to, it was like here and then maybe next week would be a day. And it's like, wait a minute, every week we delay or every day we delay this is money that we're paying for the old system.
Right, and it's not a day, it's a week at a time.
Right. And I remember us going through the same thing, and did we get extra training days? Did we get a discount? I remember we got something. I think he gave
something, maybe a handful of days.
Bill, why don't you and I partner, and you and I will write a letter to them, and see who we can light the fire.
Yeah, I want to get on the HR, so
They're the same.
it's worse
So,
because it's everyone on the HR. And that's what we've been doing in advance. We gotta know that.
Jen's schedules, it's basically the same every week, payroll and everything. I mean, it's not like Tuesday this week and Thursday next week.
Right, well, that's true in regular times. Right. We're still working through implementing the new pay rates, both on the hospital side and the county side as a result of the CSCA contract and the adjustments we made to the payroll schedules. And I have a brand new payroll clerk in the hospital who went through their first payroll cycle for the very first time last week. And took a tremendous amount of hand-holding because it was their first cycle. So we're not in regular times right now in the payroll. And again, Jen has about 1/3 of that work, and Nicole has 2/3 of the work because of the hospital. And they're on different cycles. So we really don't have a week off. It's every other week is payroll.
Is Jen the only one who can do that
Jen and Nicole are the only 2 people who can
in the entire county?
in the entire county, and God forbid if they ever, that's part of the problem, because Sue Friedhaber was younger and she quit. And we've had to work to train Nicole, which has been a challenge for us. We don't have, well, I've talked about this in this chamber many times, we're exposed.
Can we,
Have backup, we're operating in multiple systems. We run payroll for the sheriff's office, we used to run a different payroll for the highway department, we run a different payroll for the hospital, we run a different payroll for the clinics. It's crazy.
Is payroll something that could be outsourced?
Sure. I think it would cost us significantly more because it's complexity. But we can look at it outsourcing.
I mean, you know, I'm not sure about government entities, but a lot of private enterprises
I've looked at it
outsource.
because of the complexity of our payroll with the various pay rates, adjustments, steps, union contracts, it's very, very complicated.
Okay.
You foresee more difficulty though in finding qualified people to do it?
We had some difficulty, I mean, there is a light at the end of the tunnel here, because when we finally get the units rocking and rolling, it's going to be a real benefit to the payroll system. Currently, anytime there's a change, an HRS change, meaning a change of address, a marital status, change of a tax, or anything that touches someone's payroll, it has to be entered 3 times into 3 different systems, manually. So not to mention the rework that's associated with that process, but every time it's entered from system A to system B to system C, there's an opportunity for an error. And when we work on one single platform that will allow that information to disseminate across all of the platforms it needs to, not only will the workloads significantly reduce, but the rework will reduce and the opportunities for errors. So I think we're ultimately on the right track. It's just slow. Do you agree with that, right, Bill?
I do agree, and I think adding extra help sounds great, but I think that they need to know the payroll piece. Like, it's not as simple as data input, like Jen, and when she has an IT related thing, like if they're creating a database or like a spreadsheet, Joe or Kyle will get involved for that help. But that person needs to understand payroll. You know, they're not just putting in like, oh, here's 500 columns, enter them in. That's not how it works. It's, you know, oh, this column is actually supposed to be your deductions, and you know what I mean? Like, that's stuff that you really gotta have a handle on what you're doing. It's not just a simple task. So it's a tough spot. I get it.
And they add to that, you got the clinical adders and stuff to.
Oh, the hospital payroll is very complex.
Right.
And on top of which, most organizations in this day and age are not paper driven. They're electronic files driven. We are paper driven. Many of you who've been over to my office have seen the records room. We're completely paper. I mean, we're 30 years behind in terms of our HRS systems. But that's where we are, and that's where we're going to be, so we live with it.
So Bill, I think what I'm hearing is that right now, the best option is just for us to get together and just come up with the days that are conducive with payroll input and get those days dedicated from Eunice for the training.
Yeah, we can do that.
And I've got Jen working.
And a phone call too.
I've got Jen and Nicole working overtime to the limit of their capacity, just about right now, trying to keep up. And I'm actually telling them to go home because they're getting burned out. I think Jen did 50-something hours overtime in last payroll.
Thing is, Dan, we're spending as much as a full-time person just to keep the existing system operating for 6 months.
Yeah, I hear you. I've been raising this flag for a year. I'm in this room telling you that those projections were unrealistic and weren't gonna happen for a year.
So we know the problem, but do we have a viable solution? I don't think so. I haven't heard one. Unless I missed something, and I don't know. I'm not pointing fingers. I'm asking.
I don't know.
Because we've got Janice is here, Bill's here, Dan, you're here, and Colin's here. As Dan said, the amount of money we're paying for continue with the contract. We've been having this discussion for how long?
It's, you know, I mean, first time in 20 years that we switched over to computer system, I know.
Yeah.
I don't want to say we didn't do our due diligence, I mean, when we got into this, I believe we thought it was gonna make everything easier, and it will, when they all get done, but the switchover is way bigger than anybody anticipated or Munis ever informed us of.
That's not unusual.
Well, I understand that, but
And I think, and I could be wrong, but I feel like when we started this, and maybe Robin, you can chime in. I feel like we thought that they were gonna run parallel. So we were training with the financial people and getting that set up, and we thought that was, the HR stuff was going on at the same time.
Which wasn't.
And I'm not sure what happened there, why it didn't happen that way.
I mean, I wasn't here for the start.
So, but I remember when we first started with the financial piece, you know, somewhere over here, we remember them talking and working with the HR department for stuff at the same time. So I was always under the impression that these two things were happening because we were using completely separate people from Munis to work on those programs. So I'm not sure what happened over here. But I was under the impression, you two, that we were all moving along and we were gonna combine at some point for budget. I mean, the HR piece pulls into the budget piece, so I'm kind of at a loss of like, how am I gonna do the budget piece with no HR piece? Because that's how it comes in. So, yeah, so everything here still affects everything that we have going on in the financials. I don't know. I guess I was always under the impression that they were going together at the same pace.
What I see, Dan, is that, you know, we have not yet clearly identified and then articulated what needs to occur before you can convert to Munis. Is that a correct assessment?
I can speak to it in generalities, but in specifics, I can't, to be honest with you. I'm not close enough to the nitty-gritty.
So we don't know what needs to happen.
Well, I mean, we do, but I can't articulate it.
Who is in a position to do that?
John, who was leading it for me.
John Ford,
Yes,
he was leaving.
yeah. And Jen, who is also leading it. And Sue, who also left. So, I mean, I can give you a punch list of things that are needed to be done. I'll have somebody put that together, that's not a problem. But Janice is right. We stopped getting parallel support from Munis for the payroll side about the time of COVID. And we really haven't had their support to my satisfaction in quite some time. And we've talked about that before. You know, Bill and I have been talking about this since he came on board. It's almost a year.
Well, simply writing a letter is not going to necessarily, we get us there. We're looking for an endpoint here.
But to get it documented in black and white is my thought.
Okay.
So they'll have that, right, because that's what Jen is working with, they have a list of the items that they're working on, so that exists, and that's like the document that was saying that our go live date is planned for June, some parallels in April and May. That's on that punch list.
Who's they?
Check.
Munis?
Yeah,
Oh,
to go live would be, I said May, I'm sorry, in May and June would be like go live, and then there's parallels in April and May, like she'll run PCS and Munis at the same time to see if they match up. So like that punch list does exist, it's just when they cancel a meeting or whatever, now that gets bumped out, because if we have a meeting today and Munis cancels, we don't get a meeting tomorrow, we get a meeting next week, or like it's just not, it's not normal business practice for if I can't catch up with you today, I can just call you tomorrow, you know what I mean, it's just, everything is such a delay, and anything that doesn't happen that day is just pushed.
so I get the impression that Jen is not available much of the time.
Say that again.
Jen is not available for Munis training much of the time. Because you've got 2 alternate payrolls that you're working through, and so she's busy with that and training the new person at the hospital.
She's making herself available anytime that Munis indicates they're available.
She is,
She
okay.
is. The problem is Bill says the Munis isn't always available. And occasionally they cancel, and we're talking about Zoom meetings. We're not talking about face-to-face where they sit side by side working together.
Sure.
And sometimes the problem that we're trying to resolve also needs IT support, either on the county side or the hospital side, which means we have to bring another group in to assist. I'll be happy to send you the punch list and show you, things that we're working on. And Bill's right, we have a schedule.
Yeah, I don't know what the solution is, honestly, and like to talk about hiring a person, that sounds great, but I've had 2 positions open almost since I started, and we've had almost no luck, so like he's gonna need a qualified, it's not gonna be data input, he's gonna need a qualified person, and I don't know, maybe those people are more available, but I think in today's market, it's rough. I went to Alfred State, I know someone that's in admissions down there, and they struggled hiring from their own students for a senior program. I just had this conversation with maybe about a month ago. And they're struggling, and they're teaching the kids the stuff, and they can't even recruit from their own school. Like times are tough as far as jobs. So we probably could get someone, maybe, but I don't know. It's scary stuff, because I reached out to that person that worked at Alfred to see if I could scoop someone up, and they laughed.
And I think like Bill said, it's not something that, like, I know when we did it, we all took an active role in it. It's not like we can say, we need this clerk to come and enter this stuff in. It doesn't work like that. You need to be hands-on, on it every minute. You just have to work harder, longer hours. That's all we've done for the last 2 years, right? That's what we do, but.
Person doing the work is the person who's got to do the work. And you can't substitute that. You can't have some other person do it. It's got to be the person, as you say, who touches it every day and works with the tool.
Do any of the other people in your office assist? They should at least have an idea of how it works.
Yeah.
You've got a lot of people there.
But
For the HR, the HR piece is the same.
Almost all the girls are involved in HR, right? Because I know that
everybody's doing data entry. I would argue the fact that I have tons of people. I'm so far behind right now, the work that we're supposed to do. I talked about it here at the last meeting. Data is exclusively associated with civil service, the towns and villages and school districts. And that's with almost 90% of the work she does. Okay, and then that leaves me with the other two. And they are, in addition to involving themselves training and discipline administration and all the other things, and recruiting, and advertising. I mean, we're trying to hire 90 people. I'm screening applicants. We haven't done any HRIS filing in the filing room in 3 months. I showed a couple of you who were over there what it looks like. It looks like a bomb blew up in there. It was pristine 3 months ago. Cheryl and I discovered some mistakes when we were doing the payroll schedule, only because we're so far behind in the data entry that the updates weren't in. Because we haven't had a chance to do it.
So the new system, I'm just curious, will the departments be entering in all like the 426 and all that information, all that sort of change, address change and all that kind of stuff, and forwarding it to your office where they just approve it?
No.
So that'd be convenient, because you're the ones, because we're doing it on paper and sending it. I mean,
Doing that twice.
why wouldn't we?
Now it's being done 4 times.
Wow. But in the
But-
future,
But why wouldn't we just put it in and send it to you, and then there would be no paper, and it would. I'm just curious, because I've been thinking about the end game of that paper piece won't be there.
And in theory, you might be able to do that with rights and stuff in units.
That's what I mean, workflow.
It's a possibility. I don't want to say yes, but I mean,
I just think we should see the big picture when we get, if we're working on it, look at the big picture. What would be helpful to the HR department? Less paper, less data entry.
I would love to be in a world where the department administrator goes into the system, makes that HRIS change, so-and-so moved and their new address is X, or whatever it is. And it flows right through the system without any paper, and goes into the HRIS system, goes into the payroll system, goes into the tax system, goes into the budget system, without it being handled repeatedly over and over and over. I'd love to see that. We're not anywhere close to that yet.
That's not what the end game is for this.
I mean,
I kind of thought it was.
it might be, but I mean, right now, it's just getting there.
Right, yeah, I know, but I was just saying the end game.
Yeah.
so if I'm hearing it correctly, we don't really have a viable solution. And we're going to continue to live along.
I
Is
think,
that correct?
I think that the solution is to be as aggressive as we can with Munis, to get as much help as we can from them to implement and get the system up and running as quickly as we can.
Like I said, other than doing that, other than trying to work along as we have been,
And we're going to continue to pay the premium for ACS.
And I think that goes back to the letter that we sent and said, we're continuing to pay ACS, and here's the meetings that get pushed off week after week, and every week it pushes it up. So the letter probably is.
I would also, and I'd also suggest that maybe you give Gail Royce a call and offer her and her assistant overtime to get your records management room back in order. I mean, she deals with that kind of stuff every day. So, I mean, if you don't have people who can get your records back in shape, she's
Just fine.
well, yeah, but they can do that every day down there. So, I mean, you could offer her,
I'll ask her.
yeah,
Well, she can send somebody up to help. Fine, I'll ask her.
sure.
That's fine.
So, anybody want to make a motion to continue this contract?
Against my better judgment.
All right, motion on the floor from Mr. Lord, more discussion on this. Hearing none, all in favor?
Okay.
Opposed? All right, move on, number 7.
all right, number 7 goes right along with what we just talked about, but this is the Munis side. So like we pay Munis for implementation hours beyond the scope of the project, because this has gone on so long. This is to require more hours, not, I don't want to use the word support, because it's not support, but it's like implementation. Or if, like Janice and I had a conversation the other day, if she wants specific training or, how can I put it, for building reports or
And
something
that's,
like that.
but I'm still wondering what's included, because I don't have the initial commitment, what's included, because we've never gone through a budget process. I have instruction books, but I don't know how it ties into the HR. I don't even know what the HR looks like.
Right.
So, but I know it ties in. So those are things that I don't know if we're supposed to pay for or not pay for, so we need to look into that. I mean, it feels like it's part of the process, but we bought. But anyways,
Yeah,
hopefully this is enough.
I just know in the past, like when we've asked questions as far as like if this is included, I think normally they build it into our project spec, but we've blown out all of our hours for different things, and we converted hours for different things, and we're past everything that was built into this project. So like this is going over and above what we spec'd out whenever we started this. So yeah, again, like, things have gone on a really long time. We've used a lot of hours, but we can still ask. Yeah, sorry.
So do you know the effective date on this
For the munis,
for Tyler Tech Gas?
it would be, I guess, from March 1st and then maybe till the end of the year, till December 31st.
All right, now motion by Supervisor Becker. Any discussion on this? All in favor? Opposed? That carries. FYI, Joe.
Yep, so I have an FYI for renewal on our Zoom Pro account. Last year was right around $200 again, I'm waiting on pricing. Yes, a couple weeks ago, but having some trouble with some vendors and haven't got back just yet, so this should be substantially low, but it'll definitely be under $1,000, but just wanted to bring that up. And I have one other contract that came in late, as a walk-in. And it's for Brian, and I have the documentation here for you, Cheryl. It's for Brian Parisi Copier Systems. And
Wait, can I hold him on? Let's do our budget first, and then we'll take,
did I say one?
Yeah.
I thought page 2.
Oh, I didn't look at my last sheet. Sorry, lots of papers today. Yep, let's go to 9. So number 9 is Divergent. That is our phone vendor. This is a renewal of our phone system as well as some help with implementation of the actual product. So basically when we cut over, we'll have them on site for support, because when we cut over, everyone will cut the same day at the same time. So there will be issues. So we'll have to store them away. So having them on site is a big factor. But yeah, so this is renewal of our Switchbox VoIP phone system for my Virgin, so. Oh, I'm sorry, the amount is incorrect. It didn't include the support. It's 14,000, not 10,500. Sorry about that, Joe.
14 even.
14 even, yep.
Motion by Supervisor May. Any discussion on this? All in favor?
Aye.
Opposed? Carried. And you walk in?
Yep, okay, so yeah, the walk-in was a copier contract. So this is for copiers that are in the historian's office, sheriff's office, youth bureau, real property, and 2 in veteran services. They're saving copiers, so they don't fall under our Toshiba contract. But grand scheme of things, it's about 2 cents a copy to have support on those units for the year. So this contract goes into effect on April 1st, 2022, and then goes to March 31st.
1 year.
Yep.
And who's it with?
Brian Parisi Copier Systems.
How much?
It's not a flat rate because it's per copy, so we pay 0.0204 cents a copy.
Can you do it in a month, not to exceed? You can guess at that, you should know that.
Yeah, so it's historically been under about 3,000, so I guess if we did not nice to see 4,000, we should be good.
Okay. Motion by Supervisor Gregg. Discussion on this? All in favor?
Aye.
Opposed? Carried. Anything else?
And Bill, you've got supporting documentation?
Yeah, I have it here, one now.
Yeah.
Yeah, I just wanted to bring up some things that we're kind of experiencing as far as waiting on any equipment we order. A simple thing like a laptop dock we ordered in October, still isn't here. I ordered a switch last year, it's now been pushed out to June that I'll get it. If I were to order a new switch right now from Cisco, it's a 400+ day lead time. Right now I'm working on trying to get a printer copier for HR. There's just nothing out there. I'm trying to just get the something I can get the soonest, but things are crazy as far as IT is concerned. I know you've heard about the chip shortages. Everything we work with has a chip, so everything is just so far behind. And as far as ordering new equipment, I don't know where that puts us. If I order a switch today and don't get it for a year and a half, I don't know what that means as far as budget or, I mean, if this is to continue, we're gonna have to do some planning as far as how we order things, because we're gonna be way behind. So, this has just gotten worse from my eyes and things we've tried to order. Things just aren't showing up and the dates get pushed back. And then it was jaw dropping to hear, 400+ day lead time on new equipment. That's insane. So, and this isn't custom stuff. This is stuff that should be in a warehouse, not a shelf. It's not something I need built.
Bottom line, how do you know, how can you guess that contract's going down next month? Or 3 years from now?
We can. The only thing I want to start considering is if we have any projects for next year, then I want to start planning them out. Yeah, because I don't even know if they'll be here next year at this point. So. And some things we've gotten lucky on. I ordered laptops for the sheriff's office last year, and I ordered them in April, and they told me it was going to be November. I got them in May. It took a month instead of 8, but yeah, that's not the norm. That was just a one-off.
Yeah, so basically we're telling people, budget wise, you're just not gonna be able to spend it out of 2021 budget. It's gonna have to come out of 2022. I mean, there's Gatsby County law, so you have to spend it out of 2022. And then, use your budget that you have. And if we have to appropriate money down the road, we know that you returned 40,000 from the prior year. I mean, we don't need to appropriate it now, but we just know that that's a possibility going forward. So there's a few in that situation right now.
Yeah, I just think this would be a bigger thing for next year. I think this is gonna be a big.
So the problem is, you can't plan for next year and order something this year because it's come out of this year's budget. So you just have to be careful about what you do, how you do it, so.
So nonetheless, that was just like an FYI, things are like on delay for sure. So that's all I have.
Question, real property is supposed to do purchase this year, and I know that hasn't been ordered yet, so as long as it's ordered this year.
2022.
But I know that the funds that are in there now. Even if it doesn't, even if that receives the following
If you know you've got money, this is what I'm suggesting to people, you've got money in your 2022 budget for anything that is even vulnerably going to take some time, order it now. I say that with vehicles too. Order your vehicles now. You've got money in your budget now, order the vehicles now.
year.
Get started.
Next spend, handling a lot of things.
Mhm.
So I have brought it up a couple of times, so I know they're kind of underwater too. Yeah. So it's been.
Yes, it should, as soon as possible.
But as long as it's ordered this year, out of this year's budget. Even if we don't receive it till 2023.
I can't say that, I mean, if you receive it within 60 days of 2022, yeah, I mean, there's definitely cutoff, there's rules.
Yeah.
So, I mean, I can't promise anything.
But then she said that if that does happen,
Well,
that money
we
can
know,
get spent out of 2022, so we can roll it, right, basically?
we would have to reappropriate it. But, so that's just housekeeping, but everyone needs to be aware that things do take longer. Get it ordered sooner than later. So I think what you said.
Yeah, I'll check with Nick to see where the order is, but, yeah, again, I don't know where or how long that will be, so, yeah, we can definitely make sure that it's ordered.
Okay, doesn't she make contract applications for crazy?
I might have left it on my desk. So I'll bring it up. Yep.
Bill, I have a question.
Yep.
So when we did our space tour, was it December? We did that? We did our countywide space tour.
Yep.
IT was one of the areas that we recognized that you guys
We're all
needed.
over the place.
Yeah, you're all over the place. And you were kind of crunched for space. Now that we are, I would assume, the proud owners of 36 Center Street, I'm looking to maximize the utilization of that space.
Sure.
And there's a lot of opportunities within the county to do that. Have you given any thought to where you guys could go and had any discussions perhaps with Mike Adamczak regarding potentially consolidating IT and moving you
Yep, so.
to another location?
Mike has talked about, Adamczak has talked about getting a building and moving within Highway, or, I mean, there's talk of him having a new area. So the plan is when that happens, then where him and Kristen are, we'll be able to pull in, our guys.
Can you fit everyone down in the basement?
So yeah, because then we'd still have the other section of the basement, like just through the boiler room. So I think then we'd have sufficient space. To move out of this building, I feel like for us would be a mistake, because this is where 90% of our workload is, or 80% of our workload.
Okay,
But yeah, it's I have thought about it before. At the same time, I don't have any other place that necessarily jumps to my mind where we could go and have one solid office space, so. And honestly, we've changed a little bit of how things done. I worked in IT before I was over 911 here at the time. And we never had meetings or anything like that. We just didn't, no one had the time. So now we kind of made that a precedent. At least every other week we're having a meeting, so we can all be on the same page.
within your group?
In IT, yep. So we're trying to make things work better. So as best as I can, I guess.
What would be the issues associated with you moving IT out of this building? Would it be just too much, or you just concentrate most of your work?
Yeah, so most of the equipment that we work on and a lot of the users that we see every day are usually here. And at least in my eyes, infrastructure is all here. The virtual infrastructure next door, which is probably 90% of the servers across the county, is over in the sheriff's office in 911, just in their room, it's not their equipment, but, so there's that. And then the network here, to be at the Ag Center, now technically, we have a connection, a direct connection over there, so that's better. But I'd like to be on the network here, because if I was, say, down at Highway, we would have to VPN into this network to do any work here, because we wouldn't be directly connected anymore. So that would be a hindrance, and then two, anytime there's an issue, someone's gonna have to drive over here. Not that the commute is bad, but it's just, they gotta then report their mileage and, you know. And, so it's just an extra hassle for them to do that.
So that basement area is your preferred choice in terms of location.
Yeah. But I mean, it works for us, so.
All right. Okay, thanks.
Okay, any other questions for Bill? Thank you, Bill.
Yep.
Rob, come on, you got money down there. Your sales tax update, everybody go look at that. 23%.
Let's try it then.
Yeah, so
Food.
I give Jen anything I did yesterday.
23% already above to.
Did you send that out yourself? Did you send it out electronically?
Yeah.
Oh, it is, okay. All right, yeah, it's here. All right. Got it.
That was the two payments that we got in February. So one was 1.3 million, the other was 300,000, so I hope we haven't gotten anything since then.
So compared to the budget, how much over were we on sales tax?
We don't budget, it's monthly.
No, I mean, no, not monthly, but in 2021 versus 2020.
Oh, I
It
didn't
was
look at it.
18 million last year, it bumped up to 20 million this year.
Okay. 1.2, 1.6 in that range.
Last year,
Okay.
this time we were 1.2.
Okay.
Now we're 1.6.
And now you bumped it up to 20 million for this year.
And we were over 20 million in 2021, just so you know, we got a lot of sales tax. And when we did the budget in August of 2020, there is no way you could have predicted that, no.
Yeah.
I mean, we had no idea what COVID was gonna do. That's a lot.
We're still here.
That's good. You can start spending. I always tell you, don't spend a day, it's all accounted for.
That's right, you do. And more, and then some.
Any more questions on the sales tax? We'll move on to number 2, amending resolution 432.
This is for the postage machine down in the first floor down here. For the actual machine, apparently, if you want to keep your machine, this is working well, it costs more. I said, it's a good machine, do we really need a new one? And it was about $300 more. So it's for the new machine and then maintenance on it for the postage for this building. Mini, which is a body of machine I'm learning, or like a card membership. Body machine. And that was 2,100. That's March.
Motion by Supervisor May. Any discussion on this? All in favor?
Aye.
Opposed? Carried.
This is a contract with Foot and Wire for our bankruptcy proceedings, which we, our contract was stuff, and then gave us a freebie on where all of our bankruptcy stuff is. So he brought the contract with him, so this is up from 7,500 to 10,000 per year for bankruptcy, now that he's able to do more and go back and do more research and stuff, now the price has gone up, so that'll be for the next 2 years. A year, yes.
So it's a $20,000.
Yes.
Carried. A motion by Supervisor Brick. Any discussion on this? All in favor?
Aye.
Opposed? Carried. Discussion on a stipend for
was brought up at the January 4th Finance Committee, so I didn't know, follow up on that, so you're right.
that we, if it can, we held it off because we wanted to see how much longer we were gonna be going ahead, basically.
Right.
Now we're more set in stone, so, I don't have the numbers in front of me, what we talked about.
Executive session, I didn't see it in the minutes.
I think it's the same as what Joe was given, you know, one time for.
It was the January 4th minutes, but yeah, it's an executive session.
Sure, it was executive session.
Yeah, you're right, I think that's what it was, yeah. I mean, we can figure it out when she can get it next month, is that, I mean, we could, right, if they can settle on it, rather than negotiating it here now, sell that offline and bring it back next month. Is what it is. And
I have a question, Robin. I understand you intend to run for the treasurer's position. And is there a special election required in the interim?
No,
No. Okay, so you're going to continue in your role right up to until the November election?
Right.
Okay,
No, that's December 31st, January 1st.
I'm sorry.
Wouldn't that?
Yeah.
One person at a time, please.
January 1st, so it's.
As elected.
When did,
Robin, you and I talked about, are you gonna go through with something like that, or are you gonna hold out?
Right, I haven't spoken with Dan, but I mean,
So let's just say more to come, because she's got a quasi plan in her brain that she needs to vet through HR
For,
for the
for the balance of the
year.
year.
okay.
We can talk about that briefly right now. Obviously, the positions are all going to have to be conditional. And it's going to, there's going to be a potential domino effect. So we have to build a situation where, as people assume the responsibility of the vacant office, we're going to have to backfill and then backfill. And then in the event that things don't go as planned, people have to have a place to retreat to. So we've been talking about a strategy that protects people and make sure that they have a place to land and also allows you to run your office efficiently and putting people in the right place. So we pretty much got that worked out, I think. And we'll be coming to the HR committee in the next round to socialize that plan.
No, not a great turn to rules. You'll help her figure that out, and she'll bring it here.
That's the reason I use the word socialize rather than present, because I had planned to talk about that in my FYI piece of it, but you're right, inefficient.
Because you got scolded, remember, by your supervisor at work.
I don't want to be socialized and scored by.
Well, but here's a tidbit for the supervisors to know. Unlike with the county clerk, who had to present a resignation years ago to the governor, remember, a lot of you will remember, the treasurer's office resigns her post to the county clerk. And she's done that. So in public officers law, I think it was public officers law that we were looking at, the board of supervisors has the ability to temporarily fill that position. So when she gets her ducks in a row, that's what you'll be hearing is her plan to continue.
Sure. Well, that was the basis of my question
Yeah.
relative to the length of the stipend that would be provided to you for fulfilling the treasurer's position, not necessarily confined to her absence in 2021. Follow me? Okay.
You'll be able to appoint her temporarily as county treasurer.
When?
The stipend will wait, and then we'll.
At any point after Cheryl's resignation, date.
Was her date
March.
Friday.
Friday?
Yep.
Okay, so we could appoint Robin today.
You could. In doing so, though, she's got a planner for, because she'll need an extra body.
Right, because we've got to backfill her. The person we backfill her has got to be backfilled, and then we're going to have to do a hire.
Right, but that's a formality, Dan. I mean, regardless of that fact, we can still appoint a treasurer effective today,
No.
Effective Monday.
Monday. Okay,
Or Saturday, depending on how you look at it. Cheryl was done on Friday, it was business. So, but I don't know if we need a treasurer over the weekend. That's
all right.
that's a thing to think about. I don't know, that's Robin's.
I'll tell you what, we need to reserve that for maybe committee of the whole. Or,
Yeah.
Board meeting?
Robin's got her.
She can get her ducks in order.
Out to-
Yeah.
Okay, all right.
So we've had this preliminary conversation and she's prepared to do something next month. She just wasn't prepared to do anything this month. So nice and neat and tied in a bow, it will be on your agenda next month. So then you can see the entire.
When you say next month, you mean April or this month's board meeting?
In April, yes.
April finance.
Right, but so would we wait to appoint her?
Yeah. she's
In
a
April?
deputy, she didn't serve.
Yeah, she's already serving as the deputy. I mean, it's automatic, right?
All right. Okay. That's fine.
It gives her time to think it through and to not jump the gun. So.
A lot of moving
We're
parts.
not,
A lot of moving parts.
Okay. So we'll move on to the 2022 appropriations.
Yep, this is just for the Ag Center was appropriated in 2021, since it closed yesterday, we did in 2022.
It's all.
So when Sarah was here,
Went to the clerk's office for cash, all in file, and everything.
It's all filed?
And I would like to, thank Robin for all her work, treasurer's work, treasurer mayor prior to that. Jennifer Wilkinson, and then Sarah for, it was a great team effort. And the roof is taken care of too.
So
Yes.
that amount,
For advising, yeah.
that amount is correct then? 3,933,500?
That's what the check is.
Okay,
Yes.
got it. I'll move it. Sure. A long time coming.
Yeah, thank you.
Okay. All in favor?
Aye.
Opposed? Carries.
Anything else?
Any other questions for Robin? Thank you, Robin.
So I wanted to start with the volunteer firefighter ambulance workers exemption. I've gotten quite a few questions about this recently, so I did a little bit of digging. Previously, Chairwoman Ryan had asked me to, so I just wanted to share kind of where we are. I know there's been a lot in the news about Monroe County adopting this exemption. So I just kind of want to talk about where we are with it and where it would need to go. So currently, we do have this exemption available. It was actually adopted back in 2002. It was adopted into local law by Arcade and Attica, and also the villages. That's where it's currently available. However, the current exemption has a cap of 10% of your property value being exempt, up to $3,000 worth of assessed value. When you look at that, all of these volunteer firefighters and ambulance workers have to choose between either receiving this exemption or getting their income credit of $200 that they get to take off of their taxes. When you actually do the math, if you take, for instance, Arcade's town tax rate, right now the cap is $3,000. To divide that by $1,000 and multiply that times tax rate, it's roughly $4.20 is what they would be saving if they apply. Now you look at that at a county level, yes, it would be, about $30, but then again, total, we're talking $35. So obviously, people are not signing up for this exemption because when you weigh the two, it doesn't make any sense. This is reviewed based on the census data. So this was first came out in 2002, and they actually write the laws where each one is applicable to each county based on their county size. And so that's why you're seeing it resurface again with the new census information. So what they did in Monroe County was they removed that cap, saying that now you can get exempt up to 10% of your value, your assessed value, which makes sense in Monroe County. Based on being from Monroe County, coming from one of the larger suburbs, Henrietta, the average assessed value is about $200,000. In Wyoming County, we're not there. Real estate values just aren't at that level, and therefore your average assessment, I would think, is somewhere ranging between $100,000 and $125,000 for your average resident. Again, you do the math, even removing that $3,000 cap, bringing up to 10% of the value, if you have a $100,000 house, dropping $10,000 against your tax rate is maybe $10 on a town level, $100 on a county level, and you're still under that $200 amount. Something that I would maybe reach out to the county attorney to ask is, if we revise that exemption, can we increase the percent? And if so, then we would have that discussion on what you as supervisors would think an appropriate percentage would be. But that would then have to go to the state legislature, which I've discussed with Cheryl. So that would have to be supported by representatives, sent to the state legislature and actually rewritten in order to be able to have that as a local law. So as written, doesn't really make sense for a lot of volunteer firefighters. And back in 2008, they tried, the state legislature actually passed to have volunteers receive both the income tax credit and the real property exemption, but it was vetoed by the governor. So that was back in 2008, this was revised in 2017. I have not heard any differently. I spoke to Monroe County and they said that that is the same currently. So that's where that exemption sits. It's a great idea, but we would definitely have to, a few steps to get it where it would make an impact.
Do veterans receive higher exemption percentages? I thought 15% in some cases.
Yes, so it's 15% as a base for a veteran who's served. Up to you have to serve for at least 6 months and then you can apply for that. And then if you've been in a combat area during time of war, there's an additional 10%. So usually it's between 15 and 25. And then they also get additional if they have disability review.
Sure. Because I see a lot of veterans take advantage of the property tax exemption.
Yes.
But you're right, not a lot of volunteer firemen or women take advantage of this because of the, do the math, right? They can get an exemption on their income taxes,
And then
It's a credit, isn't it? On their tax.
Credit, yes.
Yeah.
The applicability of this exemption is the next step as well. So let's say we did get a rise, it says 15% or 20%. And I spoke to Brian Myers about this as well. It's up to the municipalities to determine the procedure for certification. So now we're talking, okay, I have a volunteer who's volunteered 1 hour for the entire year. Are they eligible? Or is there a set limit? Also, you have to be involved for at least 5 years. So they would have to certify that as well. But where is that cutoff point? And each municipality determines that. So you could be a firefighter for Arcade and live in, in Eagle. And Eagle has passed where you have to, be 25 hours into volunteering in order to receive this exemption. In Arcade, you have to do an hour. So at the same firehouse, one person could receive the exemption and one person could not. So everyone would really have to be on the same page as far as what that determination is. So we could decide that at the county level, and if all the supervisors agree that that's what they would like to adopt at a town level, I think that would make it easiest. But there have been some other circumstances that have come up that aren't really clear about this particular exemption. One being if it's a married couple, do both get to apply, or is it for residents? That's not clear in here. They also have, if you've served for 20 years, you get to apply for this exemption even though you're inactive. Well, does that start today or is that retroactive? So there are certain pieces that are pretty vague that have come up with these counties where we really have to hone in on some of that before we could actually implement this exemption. So that would require the fire chiefs working hand in hand with the assessors. And again, if we're right on that, where it's $215 savings for your, tax exemption on a local level or $200 credit, is it worth all that extra work by your fire chiefs and assessors? So it's just something to keep in mind when moving forward on this. But I can certainly reach out to the county attorney and find out what can be changed in there if you'd like me to.
Sarah, have any of the organizations taken a position on this, like NISAC or, your real property organization or the EMS organizations, have they taken any position on this property tax exemption at all?
I mean, we're more of a neutral entity, especially with the assessors. You want to feel there's any kind of bias either way, any, exemption that comes down. That would be more of a question.
I mean, at the state level.
Again, it's just tightening up how it's implemented. And because it's so unique to each county, it's specific counties that, are stepping up and saying, we want to do this. So in Monroe, the real property market there, and work hand in hand to kind of push that through. But as far as like a state, push for these exemptions, that's not coming from the real property county director association at this point. But, we handle a multitude of exemptions, so we don't really take a side on them. It's more the implementation where they take a stance. So for example, solar, now we have to follow a certain methodology. It's not so much we're anti-solar exemption, it's just the implementation of it that would affect us and our assessors. So that's where we usually would take a stand on something, not necessarily whether we're in agreement or whether it should be.
From the state level, from the fire side, FAST, which is Firemen's Association of the State of New York, they're the only organization that really looks at benefits and do different things for fire service. So they have like loan for solar programs, tuition reimbursement, things like that. So they haven't done anything in terms of this, just that $200 tax credit. But in a number of the state surveys going back, the one that was published a couple months ago, going back to 2014, go back to the one in the early 90s, whenever that one was done. And that was one of the big things that was brought up was property tax exemptions and increasing those. So when Monroe County passed that, a conversation with Cheryl about that, and I want to bring that up next week. Is something for us to look into. That is being highlighted in the state reports. Is that something that we could provide to the members? As Sarah said, even if we decide to do that, it really gets into who qualifies and how do we do that so it's budget for everyone. We've seen some of the challenges recently in the last couple of years of state cancer coverage, and that's going to be headache for fire departments to manage. So we wouldn't want something. It takes a lot of time, but it has to be right for everyone, not just that member that's a member, but they don't do anything, shouldn't receive the same benefits as someone that puts in multiple hours a month.
Well, given the crisis that we're having with membership in our fire organizations, it would seem to me that you'd want to do anything you can to attract people to volunteer in those positions. And, if this is another incentive for doing so, it kind of makes sense.
Most of the people that I know that are volunteer firemen do it because of good of the community, not for the financial.
Sure.
Even if it's available, they wouldn't apply for it just because that's not why they're there.
But you don't know if they'll take the tax credit or not, though. But from a financial standpoint, from a property tax standpoint, not a big deal.
Again, I can, whatever your wishes are for me to report on this, I represent the county. So, if you would like to move forward and you find out a little bit more information about how that law could look, I have no problem working with Cheryl and the county attorney to see what steps it would take exactly, what kind of a time frame, and what could be, construed. slightly to make it work on the local level. And then it would be up to you, to be able to report that. And again, I can work through all that, and I'll be an advocate for the county, but I'm not the one to take the position.
I don't know, I think whatever carrot we can put out there to get people to volunteer.
I think we have to seriously look at this. It's going to be much more cost effective to offer a tax break than to offer our paid EMS and fire services.
Absolutely.
I think if it's put together correctly.
I could be wrong, but
I think if it's put together correctly, where this is exactly how you implement this ahead of time, I think it would make it a lot easier on the fire departments as far as certifying. But again, we have to put that together where this is exactly what you need to follow, and if they meet this criteria, then they meet the criteria, opposed to letting them kind of feel that. That's where it becomes complex, and that's where they get a lot of the pushback and comes to cost.
So would it be easier not to go with the 10%, but to raise that flat rate of 200?
No, that's.
So that would be
federal.
on the income side,
That's
so that has
federal.
nothing to do with real property. So the $200 is a income tax, which is
Okay.
separate from the property tax.
I was confused, I thought that,
Yes, so right now, the struggle is that you can get one or the other.
right,
And that's where it becomes difficult.
gotcha.
So I think you would want to almost ask for the state legislation to include the addition of, instead of it being one or the other, unless you structured it so that the local level was greater than the state.
I don't know what they pushed for in the state legislature when they went to get, the other counties passed, but I'm sure this is something that's come up, so I can see.
Well, I think this would be.
And I think the biggest way to go about this is determining what percentage would make sense, what that would actually mean in dollars, right? So if we determine 20% based on, the average assessed value for the county or each individual town, let's say somewhere between 15 and 20%, what would that look like as far as your taxable decrease? And what is that burden that's going to be then spread out to the rest of the town, so that you go in eyes wide open with, this is what we're saying that you can
And
do.
then is it an active utility anyway, because we're gonna take it because the $200 income tax credit is still greater than what we just done.
Right, so we have to find that spot that makes sense. Where is it, where they're actually receiving a benefit that's greater than that income amount, but it's not so high, that you're gonna get pushback from other members of your town or just where it makes sense. And so I think I'd have to go in and see what the average assessed, I can either do the average assessed value for the entire town, or I can get a list of the active members of the fire departments right now and key in on those assessments and see where we would be for each town based on who's currently would be eligible.
This wouldn't affect the school tax, so.
No, it does not affect the school. Right, only no. I'll get that $200 mark, yes, but no, this is nothing.
See, I look at this as being in addition to the income tax credit. And I would think that it would be a no-brainer for our local elected representatives, the Senate and Assembly. I mean, if you're going to support your local emergency responders, this is a good way to do that. And to Mike's point, a paid service is going to cost you a whole lot more money than this. And I think it would be, you could qualify it and say, hey, listen, if you're a social member of the fire department, maybe not, but if you're an active firefighter and you're responding, sure.
And speaking from being a firefighter for over 20 years, I kind of have an issue with this because you will pick up the people that wanna get that tax break
Right.
and don't help you out. I mean,
Well, there's some qualifiers though, you could
I
say.
know, and then it's gonna leave the paperwork for the chiefs and.
Right.
And then there's gonna be discrepancies.
Yeah, right now it's just a click when you do your.
Yeah, I'm getting it, Mike Roach ain't because, and we're reading, people.
Sure.
But
you know, I mean, from-
applaud the incentive side of it, but I really don't know what's gonna drive people to go down. You know, unless it's a big paycheck, and we just can't afford to have it. And it's really discouraging to me as a member of 20 years to see that there's just not people coming out to help out.
right. But the burden would be, the burden of proof would be to the assessor. I mean, I don't look at this as being, oh, wait a minute, I don't look at this as being any different than an ag exemption. There's some hoops you gotta jump through in order to get an ag exemption on your property. And that goes, you sign that form and it goes to your assessor every year. You know, and so that's how you obtain that exemption. But you know, why not the same thing applies? You know, you have to certify that you are an active member, and, you know, maybe there's some checks and balances.
You know, you take your Schedule F and prove you make $10,000.
Not if you rent ground like I do.
Well, we always
Well,
require.
you have to have an agreement with somebody.
I have to have a 5-year contract. That's right.
We do rely on other agencies though, such as soil and water. So part of the ag exemption is you have to provide a map of, you know, what soils are what. And you can-
Absolutely. That's
So
right.
we do rely on other agencies also to provide information to us so that we can accurately apply that exemption.
Right.
So it's the same idea. We rely on the fire department to provide us the information that, you know, allows us to apply that. This is where, as an assessment association or the county directors association, this is why we don't take positions, because we don't want to look like we're biased in any way. So that's why, you know, as a town, as a county, you have to come up with those procedures, the certification, working with your fire chiefs, that would make it as simple as possible. I think the way to do that is to, you know, create a law that's very explicit, and this is what qualifies, this is what doesn't, and then come up with that procedure on a county level that is going to be accepted by all towns. And then it should ease the burden on the fire department, but we'd still have to receive that in order to apply the exemption, just the same as we do Schedule F, the soil map. You know, we still rely on other bits of information. Same with nonprofits, they have to provide us a certain information. You know, so it's not like you can just self-certify that they're allowed to have it. So, and to put that burden on the assessor would, again, maybe shift almost to like the political end a little bit, like she's approving it for this person, but not that person. And that assessor really needs to remain unbiased, because that's their job. So we'd really need to have that certification from the fire department.
Another problem, you said active members, there's some people that have spent 40 years in the fire department. And they're more of a social member these days because they aged out. And somewhere along the way, those people might be the ones that need the tax break too, as they're on fixed income. You know, how do you repay them for what they did for 40 years? They're now older and just can't, you know, they can't go into the fire longer. They still do what they can through bookwork and what have you, but it's a difficult question on that.
So they do provide, if you've been active for 20 years, you can apply. It does not say whether that is retroactive, you know, or if it applies now. But another nice thing about the exemption is it does carry on if that person is deceased. Their unremarried spouse can receive that in the future. So that does help for some of those older participants.
Sarah, you're saying that this would just affect the town tax, not the county tax?
It would have to be adopted on both levels, same with the village. So we'd have to adopt it on a county level, and then would also have to be adopted on a local town level for any municipality that is attached to jurisdiction. So we obviously tax on a county level, each town would have to also adopt it for their town tax.
We don't have town tax.
Yeah, but
That's the other thing.
Same with us, but you would just adopt the
Eagle, that is what as well.
It's very small town tax.
So they would still receive it on a county level, but again, does that reach the $200? Because that was actually brought up to me. So that's where it becomes a little bit tough as well.
So we get a pretty good break.
So I'm thinking that it might be beneficial to advocate to raise $200 on income tax. Just, you know, try to advocate for that. to raise it to like $500.
That's what I was thinking.
It would make it much more simple if they could do that, and we could do it simultaneously, but for the benefit of that.
Yeah, or in addition to.
It would be a lot
Or in
less
addition to, that would be
confusion.
helpful too, they don't want to do higher than 200, they can receive both, it sounds like
But
it's
then
something
the
that's
results
passed
would be another.
before the state legislature level, and now that we have a new governor, maybe, who knows, who knows? Seems like that's the biggest barrier. Any questions on this? Okay, this is an info only, but just to keep you apprised of what we're doing with GIS. This was kind of a big item for us. So at our last GIS committee meeting, we had Esri remote in. They did a large presentation. At the end, they actually agreed to come and they're going to be up in Rochester at a big GIS convention. And they said they're going to carve out 2 days to come meet with each individual department for a needs analysis for our current software, which we are not even close to utilizing what we can with GIS. And I know you've put a large investment into it, so I'm very excited about this. The committee is very excited about this. One thing we would like to do is, maybe get some departments that aren't really utilizing it right now, that maybe could, like social services or whatnot, maybe to engage a little bit, see what they might be able to benefit from. So during those meetings, they've asked for the department head, as well as the main contact person for GIS in that department. And then we're going to extend the invitations also out to the committee chair or whoever oversees that particular department. You can come, sit in, to learn more about it or not, it's fine too, but so that is coming down the pipeline, and that was very exciting. GIS is a very large company, so I was excited that they're going to come here and do face to face. We are also, while we're on the topic of GIS really quick, we are currently submitting boundary changes for the U.S. Census Bureau. We received that invitation to update boundaries. We have not done that. They don't even have a record of the last time we've submitted our boundary changes. So there were quite a few that we have to send off. I'm sitting down with Joanna this afternoon to sign off on those final changes that will be sent to the Census Bureau. So that was a very large project. We required resolutions with annexations and a bunch of information to get that right. So that will be corrected. So that's a great thing moving forward. It's a very good project for us.
Okay. Question on GIS. Disposition of fixed asset.
So the other day, we went out to start the county vehicle for real property and did not turn on. So it was towed over to highway where they perform last rites, and we now have to dispose of this vehicle. Luckily, coming down the pipeline, zoning is upgrading their vehicle. Unfortunately, like we talked about with Bill, everything's kind of backed up. So that will be coming our way. In the meantime, zoning has been great with letting us borrow their vehicle, especially around Jackson's State. It was a huge deal, so we thank them. So we just need to get rid of this asset, and we will be acquiring that in the future.
Yeah, motion by Supervisor Ryder. Questions on this? All in favor?
Aye.
Opposed?
Sarah, this has the title and the registration and everything that now I can log on.
It's actually my office.
Let's get that down there, and then when Brian Becker is ready to make a move, it's ready to go, and we don't have to scramble for having that.
Okay, yep, we have all of that.
Cool.
Yeah, there's a new key that somebody steals it.
They don't anywhere.
They got everything.
Doesn't
We might make up on it.
It's not going anywhere, that'd be sort of tracked up. And then number 4 was just kind of housekeeping with the GIS payment for training. $6,000 is coming from the grant, Health and Human Services grant. So instead of us paying for it all and reimbursing real property, we're going to split it up so that it's a little bit more clear who's paying for what. I did provide updated quotes with it split out, but it's just $6,000 will now just be paid right out of the grant. So essentially lowering the amount that we're requesting to just the $2,250 for real property.
Motion by Supervisor May. Any discussion on this? All in favor?
Aye.
Opposed? Carried.
Anyone?
Question to Sarah. Thank you very much. Hospital. Should be a big jump.
Good morning, everybody. General update for the hospital. First, I want to start out by saying that January was a perfect storm for the hospital. COVID peaked. We had a high census. Staff was leaving to go work for agencies, so we needed to hire agency. We were on diversion. We had the inability to move patients from the hospital to the nursing home or to a rehab center. And we didn't do any elective surgeries in January, which was mandated, most of January, which was mandated by our governor. So our financials are not great. In January, we lost 1.6 million. Our budget was to be at 594,000 loss. And prior year, we had $105,000 gain. However, in the prior year, we did receive a subsidy from the county in January of $1.1 million. Again, with staffing, our staffing crisis continues. We do have a lot of agency staff. We have agency staff on the surge floor. We have agency staff on our OB floor. Respiratory department has agency staff. Behavioral health has agency staff, and skilled nursing facility has agency staff. Agency staff is extremely expensive. That is kind of where we're at right now. The union contracts will kick in, and we are holding a job fair on Thursday. And HR is advertising pay rates as well. We continue to have difficulty placing patients in SNF and acute transfers in the regionally. For example, if a person tests positive for COVID, we can't move them for 10 days. No matter if they have symptoms or no symptoms, we have to keep them for 10 days. So that also it's a problem. We continue to scramble with staffing and move things around as we can to continue to have all the services that we have. Currently, the COVID rates for the hospital declined. Currently, we have 3 patients in the hospital that have COVID. We're still meeting senior management along with county Department of Health, Supervisor Ryan, and other Brian as well, and other agencies. We continue to meet once a week. We look at COVID in the county, we look at COVID in the hospital. We are looking at staffing, we look at capacity, we look at supply issues as well. Talking about supply issues, we too have supply issues with a multitude of things. Things are back ordered 2 and 3 times of being available to get needed supplies in. We're looking at vendors that normally don't even associated with it to get product in. Elective surgeries have started. The mandate was lifted statewide. We continue as far as looking at finances. We continue to look at ways to save money. We're exploring multitude of things. We're looking at possibly some new businesses, investing in some new businesses, looking at staffing, leaving no stone unturned at this point. Non-COVID related information, the Mount Morris Dialysis Center has successfully achieved our federal approval and is now accepting new patients. Right now, we have enough room for about 3 more patients and we'll be considered full, and we are talking about looking for more staff to run 3 additional days. The lab project is in phase 2, the $3.1 million transformation grant project. Currently, it's asbestos abatement and demolitions underway. It's expected to be completed by the end of May. We do have some work being done in-house in order to keep us on budget and to save money. We also just recently received a $100,000 grant from the Community Foundation of Greater Buffalo, the William Field Trust Fund. I apply for that every year on behalf of the hospital. That $100,000 grant will be used to purchase new anesthesia equipment for our operating room. Any questions? No? Okay. I'll go through the contracts. The first contract is for DCCS Consulting. That is our interim CFO. It's to extend its contract. It was up as of April 18th. That's to extend it for 6 more months from April 19th to October 18th. Not to exceed 150,000. The next one is Aqua Solutions, which is our transcription service. This too is to extend the terms from February 1st through next year. And that remains the same as far as cost goes. The next one is number 4 is Johnson Controls. That's for our fire protection in the hospital. That's an upgrade, upgrade the hospital fire panels. Excuse me, wiring and older devices. That scope of work is in the capital budget and it's $335,000. The next one is for Zero Alai, who is a podiatrist. That's to bring him on board. Currently, we do have a podiatrist that's here between a half a day a week and 2 half days a week for a cost of almost $100,000. This podiatrist will be here 5 days a week. He will be seeing nursing home patients as well. We have a subcontract right now for nursing home patients, and we'll be utilizing him as well to go to the cloisters, hopefully, as well, to provide through there. The next one is salary amendments for Schedule C. We're abolishing the Director of Clinical Data Abstraction position, which is about $115,000. We're also abolishing the Administrative Secretary position, which is about $53,000. These numbers are the benefits, by the way. We're creating an Administrative Assistant position for the nursing administration area. That's an additional $69,000. And we're abolishing the Administrative Secretary for the Medical Director. We had 2 positions depending on how we can fill it. And that, excuse me, is a reduction of $58,000. So the total for that is a reduction of $157,000. Next, Schedule P, we're abolishing the Certified Nurse Midwife position. That position was eliminated due to the nurse midwife refusing to get COVID vaccinated. That's a savings of $187,000. And then it's Dr. Ali, who I just talked about with benefits, that's $219,000. So that's an addition of $32,000. So between the two, it's a savings of about $125,000. And I believe
Yeah. Any questions on 2 through 7? None. I got a motion by Supervisor Colby. Any more discussion? All in favor?
Aye.
Opposed?
Thank you. The last thing on the agenda is appointment to the hospital board. And at this time, I've been told that it's too early to be on the agenda because there are more applicants that apply.
We have other ones. And
That is,
so yeah, we're going to let off them out before we.
I think given the current climate and the importance of the membership on that board, that I think it would be good to maybe have them cut it out by a subcommittee of this, we have to do this. So maybe we need to all interview them, but that would be very intimidating and unfair.
How many do you have, Becky?
We have 3 right now.
Just 3?
Yeah.
Okay. Including this individual, Janice? Okay.
How big have it built in the past? We done that one in the past, I know we put, when Steve Perkins was appointed and Larry was Larry Rogers, it was just presented and you're on.
That's why I prefaced it, given the current climate, that perhaps this would be the way to go.
So we don't have any standard procedure, any way of done it.
It's usually whoever, chairman.
Okay.
Well, Janice sent a letter, correct, expressing her interest.
She did, and I will say that, she's in the town of Warsaw. She did send me an email and, asking if she could talk with me as her tax supervisor. Very impressive. And I said, absolutely, absolutely, I will talk with anyone, especially in the town constituent. We had a very, very, very good conversation. And she will be out of town for, she sent me an email with the weeks that she'll be out of town going forward. And I mentioned to her that I said, you make the third one that I have in my hand. And she said she was open, just my name in there. She said she would be open to go to speak with. If it was set up that way, I told her it's not currently set up that way. She felt that it probably should be as well. She very, very sharp.
There's more than one position down there to fill.
Not necessarily. The way the bylaws read is anywhere between 5 and 15 members. So.
What's it now, 8?
The reserve committee for medical. Two.
Yeah, there's criteria for it. I had to look at the bylaws.
I think it's supposed to be 15%. Which would require 2 out of 5.
Okay.
You know, and I believe it.
So it's 60%, that's the number.
I think it is. I don't know.
Now we can look to, but I do know that they reserve some membership to the medical staff.
Yeah.
Yeah.
Does Jan Shirley have any? She's not a oh, she.
She's a physician.
Yes. She's very,
She's a physician. Oh,
Yes.
it's an amazing.
She's a good.
Reading through the application and her resume, it's quite impressive.
It is.
I did, and talking with her as well.
You know, Becky, as using your words, given the current climate at the hospital and the additional scrutiny on the board of managers, my position is they ought to come and talk to the entire board of supervisors. You know, so that everyone has an opportunity to hear and question their qualifications for the job. We can do that at committee of the whole, or
Okay, given that, because
you've only got 3 people.
right now.
Right.
Given that, to be consistent, does that open up that we need to do that with every board appointee that we do?
For boards like
I'm
this.
just throwing that question out.
No, well, I'll answer it from my standpoint. For boards as critical as this, yes. Absolutely. I mean, I'm not gonna ask you to come and interview for a position on the Chamber of Commerce, or if you're gonna be on the IDA board.
Just making sure, legally.
Yeah. I think we have that. I've always been told the board of managers at that hospital served at the pleasure of the board of supervisors. Correct?
The board of supervisors is the appointing authority for members of the board of managers, yes. It is.
Yeah.
Yeah.
We can add and remove at our own will. Correct?
Depending on what the bylaws say, but most of the time.
Sure,
if the-
but I mean, if
the
we,
membership comes on the board of supervisors, it's at your discretion.
right, that was always my
And
understanding.
there's rules in most of the bylaws for removal of a member if it,
Of course.
So every set of bylaws that I've ever seen typically has some something in there that.
I have no problem with that, I'm just making sure that we're
I don't think it would go across the board. I think you get to decide on, as Supervisor Laura alluded to, you know, membership appointments of this magnitude, especially when you have more than one candidate.
So the IDA board is up magnitude too, so that also.
Potentially, yeah.
They would have to come forward to this board potentially.
Sure, but you know, most of those people we already know, and they have well-established reputations. I don't need to interview Jim Murkowski for a seat on the IDA board, you know. I mean, his commitment to the community is well known. So in the case though of the Board of Managers, some questions.
Yeah.
Yeah. Sure, brought up a good point too. The previous two board members that we appointed, Steve Perkins and Larry Rogers, were well known in the community already.
I agree, they fill out an application.
Right.
Yeah, they did I don't believe that we even knew there was an application, they did a letter of interest.
All right, because I know at school, my volunteers that I knew still had to fill out an application and be board approved. They had to go through the process again.
And they submitted their letter and.
Again, I'm disappointed that we don't follow
That's
processes,
why I want to do that now.
processes in these things. Until it becomes a problem.
Yeah, it's not a problem until it becomes a problem. It's not a problem, yeah, so we had it out in the past. But, yeah, so on this particular one, I just wrote some notes here that, consideration for this membership is gonna be tabled until other applicants can be considered. If you've got two more, then we'll do the same thing for those two if you've got them.
Considered and vetted.
All right. So, any other discussion on this one? All right, anything else from Doug? I'm good. You're good? Thank you. Any questions? Any other questions for Mike? All right, thanks, Mike. All right. Moving on to the agenda, we're done with agenda.
So I've got a lot of items on here with not much backup for it, so we'll talk about that. First thing I did want to talk about, Dan, I apologize if it comes across as frustrated and accusing of the department. This department is working, I know Jen is working like crazy. I understand the process. We are still going through it like crazy. I think it's, and again, this goes back to, had we known that the project manager was going to be on tasking off and getting with Munis, you know, someone who's dedicated to that, had we known, would have been key to this whole process. But I apologize if it comes across that way. They're working really hard. I'm not by any means saying they're not working hard at this. It's a frustrating process. I think it might be beneficial if I maybe come down and at least once a month know where we are, so I mean, we're talking hundreds of thousands of dollars for me. Where is this coming from? How much longer is it gonna be? I think that's where my frustration is when I call Bill and I say, what are we talking? Where are we? What does that mean? Does it mean HR and payroll? Does it mean just payroll and still have to do HR? So I think that's my lack of knowing where this whole process is. So,
Welcome your involvement.
again, I don't want anyone to take, especially you, Dan, I don't want you to take it as that I'm sitting there thinking, yeah, you're a real jerk, Janice, but
I'll try to do that.
I don't, but I think there is a lot of misunderstanding because I was under the impression those things that I talked about were being implemented. That's what I saw in the demo. So I think there's a lot of things I'd like to see and how that marries into the financial system, because I was under the impression a lot of that paper was going to disappear. Obviously not from the hospital side, because they're not on the Munis system. But on the county side, I think 4 to 6s, those are all gonna be electronic, which would automatically update the person saying, well, I mean, that's one staff member right there.
When I speak about,
Those are the things I'm thinking going forward, there's gonna be a lot of efficiencies gained, and that was the goal of the whole system.
so when I speak about the payroll and the HRS, I'm speaking globally rather than just county. Because when you think about the population, that is 2/3 of the population that I service is hospital.
Right.
And 1/3 of the population is county. And of that total population, almost 80 or 90% of the work has been in the hospital because of the volume of turnover that the last year and a half has seen in the hospital. We're going to report for 2020 almost 26% turnover in employment at hospital. So it's a huge volume of work. So you're right, but I'm thinking about it in a broader sense than just the 1/3 of our staff that resides in the county. Not to mention all the work associated with the towns, the villages, and the school districts, which is something that is unique to my purview.
Janice, do you know who else has this Munis system?
It's all over New York State.
Is it? And if they, have they had
And they
the
all
same
buy each other.
problems with this?
We went to.
Well, I'm gonna tell you, you guys asked me last month to check into the procurement card upload, so the vendors would come in. That day I emailed Joe, because I know we stopped because we are just not, we're accountants. We tried our best to get a form from M&T to upload it to the system, and they weren't, we just can't do it. And it's something we've talked about for a long time. And I haven't gotten anything back from IT, but interestingly, Robin asked her treasurer group, and 2 other counties said, we can't do it either with M&T. So I don't know if it's an M&T issue. And other counties have different procurement cards. M&T isn't able, because I thought, geez, we're not that stupid, we can figure this out. I think it's what M&T what they can provide us is not compatible with Munis. So how we address that? Right now, we don't have time to address it, to be honest with you. But in the future, do we switch the M&T card to another procurement vendor that can do that, which would save time in the long run? I don't really care at this point, because we can kind of have bigger fish to fry. But I understand it's a priority. I understand it's on my list. It's not something I'm able to do personally. And no one in my office can. We've all tried, we've all worked at it. We just don't have that.
I've done that work before. It's a lot of work.
And so, to answer your question, another, we were nice, we had,
Renee, maybe. Yeah.
said, she stopped and said, just shook her head. It took us.
It's a painful process. But I'm gonna tell you, there are some good things. When I go to look for something, it's right there. As long as you insist the documentation is there when you approve it, there's never a question. You go to it and you say, hey, here's that email you sent us about that. It's all there. We don't have to look for a piece of paper that someone said they sent it, and it's all there. Cancel checks there. Everything's there at your fingertips. And as long as the internet's working, you're fine.
That's the next one, right?
But anyways, yeah. So I'm sorry to, hammer on the topic again, but I think probably at some point we'll do some monthly. Well, we're gonna do some monthly meetings, but that's the piece that I found the most helpful with Munis was going through that checklist and being on them with it, saying, this isn't acceptable, how can we get this faster? This isn't acceptable, we're not gonna pay an extra $100,000 so we can push this up. What can we do to make this, I mean, you just need to have a strong voice to advocate for your people and what you need. I've found that that's been beneficial.
I welcome your involvement, and I'll have Jen reach out and schedule a time. And I'll suggest that you bring donuts. I'm kidding.
I honestly don't have time for
I'm kidding,
like
I'm kidding.
integral
Next week,
involvement, but
let's do it next week.
I feel like we need to know where you are and we need to know what the different programs are, because I was under the impression they were all being all on the same, just different lanes.
Absolutely welcome your time and involvement. We appreciate it.
So with that said, done with that. And the income statement, I've run it. On another side note, I sent an email to all you guys by accident. So I sent our notice for the 2021 expenses to all department heads. And that was my bad. It was supposed to go to the fiscal group, not the supervisors. But in case you want to know, everything was due today. It was actually due the 23rd, but we're still getting phone calls. Oh, we found this paper. So today's the absolute end because we have to draw a line in the sand because March 9th is our last check run for 2021. So like you heard Bill say, I think the Buildings and Grounds Department has something out there. There's a few people who have some things dangling out there. And that's why, and I think we're gonna be I think I'm gonna maybe communicate this a little better every year in November. We send out a memo, pretty much saying, don't order anything past this date. Don't, unless it's absolutely necessary. And this is the reason why. Because when stuff doesn't come in, that's great that you wanna get it out of this year's budget, but you can't order it on 12/28 and just wing it. I mean, this is why we say, don't order stuff on 12/28. I mean, unless a furnace breaks down. You know it's coming in. You know it's coming in. I mean, this is that pre-planning, and I don't think and I wanna make sure people understand, it's not just me just being a jerk. There are rules that you have to follow. So, we can't receive something in March and expect to pay for it out of a prior year budget. So that's, there's usually a 60-day window. So I'm hoping maybe I'll communicate the reason why I'm saying it, not just that I'm saying it. So that wasn't supposed to go to you guys. I did send them out to my finance group this morning, so my bad. But in case you want to know, that's what's going on in our world. Not intended to tattle on the department heads or, get you specifically involved. So the income statement I did run. No, it's not attached because I was waiting for 2021 information that's still not in there, as you saw sending out an email. There's still a lot that's out there that's not real. What I want to say, there's purchase orders out there sucking up hundreds of thousands of dollars. It's not going to happen. We're not going to, so I want to make sure I present something that's more real. We are also waiting, there's some big transactions that need to happen, and I was hoping they'd be in by now. One being social services, they always kind of submit something, it could be $1 million. So the accounts payable for 2021. So, I don't have those numbers. I know it's not the lack of trying by Robin, she's called and tried to get those numbers. We also do not have final numbers from the hospital for accounts payable, which could result in a lot of money as well, which doesn't affect my number 4. I don't have any numbers to finish that piece. So I'm kind of struggling because we're just kind of dangling out there where it's hard to assess something and look at it. For me, I know what's going on a lot of it, and like I can make the notes like on the side so you guys can see. But there's some work that needs to be done, and I hate to send this to you and have you be like, look, this doesn't make any sense, doesn't mean anything, so. But I can tell you, we budgeted 1.9 million to use a fund balance to offset our budgeted expenses. And I mean, if I look at this today, we're showing we're returning to the fund balance $13 million. Now, I want you all to freak out. It's really high. So where does it come from? Well, you know, 4 million is that piece that we just appropriated today. So when you take out a serial, you have to record that. So there's a lot of that going on in here that I don't want you to look and say, $13 million. Well, 4 million of it is that. 3 million of it is the way we worked on the ARPA money to get it back into fund balance so we can use it freely. By claiming certain expenses that we knew about. So there's another 3 million, so there's 7. And we know 3 was sales tax. You know, you're up to 10 now. So I want to make sure I can explain this to you, so, you know, when I have those numbers finalized.
So you're thinking that you're not gonna attach anything this month? Maybe
I'm thinking I'm not. I'm thinking it's not going to make sense
until next month.
until next month, if that's okay with everyone. I mean, I have it done, I have it saved, I can throw this up to you. So this particular report, it shows the hospital. I know Mike mentioned that they were $100,000, so somewhere in there at year end, with a $1.5 million subsidy from the county.
That was last year.
It's a 100,000.
That was a year-on-year comparison from 2021 in January.
Compared to last year.
Right.
So I do have to get, I'm like, what did he say? I'm looking at my numbers, I go, you're what? 100,000 to the good? But he also said something about a subsidy of 1.5 million.
Yes. Last year, we were
State.
in January, the figures was $100,000 profit for January of 2020.
Okay,
But that included a 1.1 million
got it.
subsidy.
So I've got to talk to somebody at the hospital to find out some where they are for numbers.
That they were recording a $1.6 million loss, and they budgeted a $594,000 loss. That was what they budgeted.
For January? Okay. So anyways, I've got to talk to them about 2021. Because I show, on my stuff is off by like $4 million. So I got to figure out what's going on. Again, that's showing up in here, so I'm not exactly sure if it's an issue of how it's being reported. I mean, I know it usually is, it's typically an issue of how it's being reported from what he reports, because they report things obviously differently because they're an enterprise fund. But
Janice, did we receive FEMA monies in 2021, or is that?
so we
2020?
submitted the FEMA claim, Project 1, in July of 2020. And we haven't received that yet, and it's not for lack of trying.
But I saw it had been awarded. Did Schumer have something to do?
Press release.
Or it was a press
It
release,
was a press release.
but we have yet to see any money.
So, no, I'm gonna tell you, no, we haven't seen any money. But,
That 20 million we had 4 years ago was a press release from 2 years ago.
so anyways, no, we have not received any money yet for FEMA, and we work, and they keep rejecting certain things. I mean, just ridiculous things. I don't think they quite understand what we're doing, but we keep submitting, what do you call that, amendments or whatever, we are not agreeing with their appeals, we keep submitting appeals, like the Trudy machine. That they sanitize the room so we can get more people in quickly.
We do expect to receive those funds in 2022.
You know, at the end, like a lot of things with the state and federal government, I don't hold my breath, but I do. I expect to see, at least from Project 1, I expect to see about $1.3 million come in.
Okay,
So that will come in, I hope. We haven't booked that money anywhere, but I would book it for 20.
and those funds will go to the hospital, or are they coming to the
A
general?
portion of those go to the hospital, and some comes to the county, not a whole lot, I'd say $500,000 to the county.
Okay,
So, but then there's 2 other projects out there. And those are all from the hospital. So that's kind of why we lent due to what you're saying, the 1.5 million. Because I know they will get paid eventually.
right,
So they've already got the money
sure,
from us.
yes,
You know, we just kind of lent it to them. So,
yeah, okay.
but yeah, are you kidding? When we see that money, there will be balloons, I think. Cupcakes, SEMA cupcakes. All right, so anyways, I have to get a hold of somebody in the hospital. Somebody hoping can help me out.
They actually have
So anyways, looking at if anyone wants my chicken scratch, I mean, I can send it to you, it's just not. I'll tell you another thing that was some big dollars was, the county clerk fees and mortgage tax, because of course housing went crazy. Who could have expected that? Oh, yeah, that was a big impact, as well as, yeah, and another thing was something that we didn't budget for very much because, I know Genesee County's breaking ground on their jail, but we are still housing their inmates, which wasn't anticipated for 2021 when we were doing the budget 2020, because no one knew what was going on with the COVID. I mean, you have to remember, this is a 2-year lag when we talk what we budgeted and where we're going. So and we also use state inmates, which hasn't happened in years. And you're talking a couple $100,000 there, but just from state inmates. So we haven't billed the state for inmates in, I can't even remember. Ever since they changed the law there where they can't stay more than 2 days. But anyways, that was a big dollar amount that we don't typically see. And I think social services is actually gonna see a lot, but they did, a lot of people, there's a lot that didn't go out the door in 2021. And I think, again, COVID plays into a lot of this, and we just don't know how it's going to hit everything. We just don't know, you know? So it's a tough, I'd say it's a tough budget year, but we came out okay. When we did the budget in 21, we had no idea we were gonna see ARPA money. I mean, think about that. That's a big deal, so. Anyways, that's just kind of a quick lowdown about the income statement, and if anyone has any questions about the enormous amount of money we're gonna see put into our fund balance, I can talk about that, but for now, I just wanna see where we are. I wanna see the impact of the retro payments and retro going forward. You have to remember that we never, we budgeted contingency for a union settlement in 2021, didn't happen. So there's a lot of things that you just couldn't plan for, but we were ready for. So, but I'll rework the 5-year plan, get that going, so at least we can see how we can move forward in the next 5-6 years and use it smartly. That's a word. All right. Number 2, that's attached. It's attached to the electronic copy. Basically, these are the transfers that would typically need to come to committee for approval, and then the board meeting. This is to clean up 2021, nothing earth-shaking, and next month, the next meeting, you'll see a lot, because everyone's shoring up all of their salaries, all of their fringes. I mean, it's gonna be all over the board. It just hasn't been done yet, and we've got to get those done, so.
We need to move these in, right?
This, yes,
Yeah,
yeah, this list.
which is, it wasn't much better.
There really wasn't a lot, I mean, it's just housekeeping.
I'm guessing what the problem was.
It doesn't, I mean, it's what it is, I mean, it's not coming from fund balance, it's just coming from other lines that typically come here. I mean, if anything looks, the only time we really have an issue with it, again, I'd say if I had a real issue with it, I would bring it to you guys. But a lot of,
We kind of approve these ones, they give you permission to do them, and then you bring them, and then they approve that.
Yeah. So I, the only time I would question it is say, if you were short in your salaries by $40,000, what did you do? How did we miss that? It's more of a me just being hard on myself, like, how did we miss that? Did we not appropriate that? What's going on? Or to me, it's like, what happened? Why do we have this much left? And okay, no, that's okay, you can use it because. So they're very well to be hundreds and hundreds of thousands of dollars. We're gonna do a transfers next month, because I'm looking, I did a quick check and I'm like, oh my gosh. But it's what it is.
So, well, you have a motion for these today. Sure. Where's Becker? Discussion on it? All in favor?
Aye.
Opposed? Carried. Number 3, the bridge.
Yeah, this is an FYI. I did it, and then I thought, you better check to see if the hospital's put in their accruals yet, and it hasn't happened. So, I don't know if it's gonna really make that big of a difference, but we tend to be in the same range about all the time. So we're about 47% range. This is just for your FYI. When I have an official number, I'll send it out to departments on letterhead, so they can use it if they need to for whatever purpose, grant purposes or budget purposes if they're presenting you guys something.
So, I do have a question, quick question. So going back to like 2014, we were up to 50 and 53%.
Yeah.
And go back to 2005 or 36.4. Why is the difference?
So I'm gonna tell you where some of those jumps happen. If, like 2021, we didn't have any increases in salary for all of CSEA across the county, then your fringes are gonna go up, but your salary's not as much. So that's gonna affect that. Next year, our salary is gonna be like double, right? Because we have 7% or 5% going back to the lump sum, right? Not double, but the 5% lump sum for 2021, the retro, that, they're gonna have that increase of 2.5. So all the salaries are gonna go up way more than what, yeah. So, and then there's other things, like some years, the retirement back then was through the roof. I don't know if you remember that, but through the roof, the salary, the retirement could have jumped 10%. So the salary, the retirement's actually dipping down. Workman's comp could have been 10% increase back then. It's been 0 for the last 2 years. So there's all sorts of different things that really impact that, but when I when I just put my eyeballs on it, it looks pretty, year over year. I'd fall off the chair if it was like 28, I'd say it'd be great, but it's not, so.
There's a couple other factors that play in addition to the pension, which is an actuarial assumption we get from the state controller's office. It also plays into the numbers of people who are actually eligible to receive pension benefits through the county based on employment, which varies up and down. So we don't pay contributions if we don't hire people. And then the Schedule X, which was in effect at a lower benefit rate for almost 50, 60 people, played into that a little bit. So there are multiple factors. And Janice is absolutely right, it fluctuates.
So, yeah, and this is based on actual cost.
Is unemployment insurance factored into this?
We don't pay unemployment insurance, but we do pay unemployment if it is warranted. But we haven't paid in 2 years.
We don't pay the state.
Not like a business.
It's not a business, but we'll get charged for our portion of unemployment for
Mhm.
particular individuals, but we haven't had to pay because of that, because of the fraud.
Yes,
And we've actually received, I don't have the breakdown, but I can send it to you guys. Once I have the final numbers, you'll see like about $100,000 we recouped in fraud because people had used other people's names and submitted. Remember that whole?
yep.
So,
So we got a credit, essentially.
we got money back from
They use my social security number, my name, and they use my address from this county, as a county employee.
Huh.
They, you know, that comes from that.
And we track that on a monthly basis. We get a statement from our third-party administrator, and we're reviewing every unemployment claim made against the county. You know, obviously, the vaccination issue that took place in November generated a lot of unemployment claims. Unemployment claims for people who were never county employees, for example. So we spend a lot of time vetting that. And then we spend quite a bit of time contesting claims as well that we don't believe are appropriate.
I got an unemployment claim for my father last year. Died in 2018.
That's the quintessential definition of unemployment.
So that's just an FYI, I'm trying to, again, it's not concrete, but it's pretty close enough. The only other thing I have is during committees, the presentation of the highway building thing, which was about $5.9 million. I asked Robin if she could come up with some estimates for serial bond for that. So 5.9 million, which she provided, low end 2.5% interest rate would be roughly $480,000 a year. And high at 5% interest rate, you're looking at $570,000 a year. 15 years.
Yeah.
Just throwing that out because I told you I'd get
It's a non-starter.
Thank you.
It's a non-starter. Especially now we got all that square footage right down the road. We could put 3 million into the Ag Center and remodel it, still come out ahead. Could build a new barn for that kind of money and still come out ahead.
Well, that was terrible.
Yeah, but you know, and to Mike's credit, I mean, it was a good detailed proposal, but he's fighting material costs, which are through the roof. He's fighting labor now at prevailing wage. So to spend $5.9 million to tear down a building at Highway and build another one to accommodate Highway and Building and Grounds, I just don't see that as a good use of county taxpayer money.
It's good to hear that paper in case.
Exactly, sure. We're lucky enough to get that, but we could easily house him and his staff right over and at the Ag Center and accommodate them there and utilize the barn for a shop. So, you know, there's space out there that could be used. And we've got all kinds of room in that building now, and we own it, right? That's just. I mean,
Number 4, we don't have any number yet, so.
Number 4, sorry, I don't have numbers. Oh, I've got numbers, I'll look at it right. Or. I'll probably have to walk in with something, how does that work? So, maybe, only because I have. We actually have to close the books at some point, so, yeah.
it'd be nice to know what that number is though before the meeting.
Well, if this is, so what we typically do, I'm gonna tell you what we typically do. I make up the numbers. So if, and I'm not kidding, it's just a book, it's just housekeeping. So.
Number 4,
So what I typically do is I take, right now, it looks like it's $4.5 million that they're net, to the net bad. What I do is I increase the revenue, $4.5 million, and I just make it so. Because their accounting is just different than ours. Ours is just, so our books, this is just budget numbers. It doesn't matter, it doesn't change that they lost $4 million. It's just budget numbers just to, what am I trying to say? Clean it up.
as long as it's just you that goes to jail.
I won't be going to jail. It's just, it's not a real number, it's a budget number. So
Yeah.
you're not authorizing anything, it's already done, it's housekeeping, it's basically so.
It seems like
It's been done like that for
funny money here.
25 years.
Oh, she's done it before.
Yeah,
I do it every year, I still tell you. It doesn't matter, we're not changing real numbers, it's just,
okay,
we're not changing real numbers.
all right.
All right. Moving on with the agenda. Next page is, excuse me, any update?
I have reports that I will hand out.
Okay.
They're nice. I know, there's like 10 copies of each, I can just.
For reason.
Yeah.
And nothing from Cheryl?
I do have a little something I can share here. I had a phone call from the Department of State, it was Susan Savage. And she wanted to know how I was doing collecting all of the signatures for our County Shared Services Initiative Matching Funds Grant. And I said, I got all but one. She goes, oh, did you do that last one? Submit the appendix C. So it's submitted and waiting to see when they send us our money. We got a little wheeling and dealing yet left to do with our neighbors, but we're hoping to get that done before we go to next step. We're hoping. Yeah,
And it's into Joe.
that's all right.
It's in Joe. It's in Joe.
No, we can.
Oh,
Does that include now the addition of the dialysis operation, now that it's open?
So our savings was their expense, which was very low. Their savings was our expense, which was relatively high. So we need to negotiate our amount that they received on their grant through an IMA back into Wyoming County. That's where we are.
Okay,
I know the number, but I'm not gonna say it because we haven't said anything to Livingston County.
got it. All right,
so
how confident are you that they'll,
I can talk about it, and we think it's pretty reasonable.
who's in charge over there?
Huh?
Is it still Ian or is he out?
No, it's Ian.
Oh, okay,
And I have had a conversation with Angela Alice.
mm-hmm,
So they know that we're coming and they know why we're coming. They just don't have a dollar amount yet, but they thought that it seemed reasonable what we're proposing, we just haven't talked numbers yet.
Okay.
Surprise. Okay. And another from Tracy, so move on to the top page of water. HR, $300, or no, excuse me. Story, $300, appropriation. Motion for that. Chair for that meeting. Becker, I'll do it. Any discussion on this one? All in favor? Opposed? Carried. Now HR, amend local law, 2022.
And these two represent corrections to typographical errors that were approved at the last meeting. We discovered them, Cheryl and I were working to clean up this, make sure that all numbers are correct before checks are issued, and these represent housekeeping corrections.
Motion by Supervisor Rick. More discussion on these? All in favor?
Aye.
Opposed? Carried. Page 12. Yeah, page 12. Social services.
You should over the three appropriations.
So he can buy a desk.
Oh.
He doesn't have an office to put it in, but he still might. You don't.
We're talking about the payroll.
Yeah, that little table you got kind of sitting there, right?
Yeah.
Okay,
Is there a motion?
yes, it is.
Motion. Supervisor Lord. Discussion on this one. All in favor?
Aye.
Opposed? All right, now on top page 12. Social services, a $38,000 appropriation for the pathways grant. Pearl Safe Harbor.
Move it.
Yeah, motion by Supervisor May. Any discussion on this one? All in favor?
Aye.
Opposed? Carried. And for public health. Appropriation for $900 million. 778 credits.
Reduction. She's just taking all of the allocations of the state, the final numbers, and shoring them up to what she budgeted in. Now that she has actual figures, she's making them down with all of these transactions.
All right, so number 278, number 4, 652, and number 5 is 31,000. Any discussion on these? All in favor?
Aye.
Opposed? Carried. On page 13, appropriation for public health. $639,000. COVID-19 school grants.
The 648, this was a grant that was awarded towards the end of 2021, but we have to cut the budget off at some point.
Any more discussion? All in favor?
Aye.
Opposed? Page 14 for planning committee. $45,000 appropriation for tourism. $20,000 appropriation for tourism and $28,000 appropriation
I'll do 1, 2, and 3.
Motion by Supervisor Brewer, 1, 2, and 3. Any discussion on these? All in favor?
Aye.
Opposed? Carried. Bottom of page 13, appropriation for the highway. Cool. Oh, is this the one that we didn't have all the money?
Yeah, this one, we said we appropriated the money, but unless they get the other 50, we have.
Yeah, they won't spend it, but we wanted to ensure that we have it there, so because when it is approved, or if they do have the money and they can get the money, we want to get rolling on it.
Motion by Supervisor Brick. Thank you. Any discussion on that then? All in favor?
Aye.
Opposed?
Aye.
Carried. Right, got page 15. All the positions amended salaries down through. We all have those.
No, I'll make a motion.
Motion to Margaret Becker. We will discuss all these. All in favor?
Aye.
Opposed? Carried. Number 2, or was it just one, or 1, 2, and 3?
1, 2, and 3. We need to have a discussion if there's, is there any discussion on 2 and 3?
Any discussion on 2 and 3?
No.
And I'll ask for, or I got a motion, but approval of 2 and 3 also. All in favor?
Aye.
Opposed? So, on the position request, middle of page 17. Deputy Director of Human Resources, and still one, agreed, so all temporary. All right. Any questions on 1, 2? Return.
You had a candidate, correct?
I have offered and a candidate has been.
Candidate is accepted your offer.
Yes,
Okay. For this amount of money.
75, correct.
Okay. When do they start?
Tentative start date of Monday, March 19th.
Okay.
Is that similar to what John was getting, what was his?
John was just about $3 short of 90,000.
Oh, so this is a saving, though.
It's a significant savings.
Plus, you don't get him an attorney in your back pocket.
That's correct. I did not have any attorneys apply for the position at all. Matter of fact, at the end of the day, to be honest with you, I had one qualified candidate apply.
Great.
We have an attorney. Mr. Bragg. As well as.
Well, they were employed.
Right.
All right, I've got a motion by Supervisor May for 1 and 2. Any more discussion? All in favor?
Aye.
Opposed? Carried. Top page 18. All we see here. 3 positions for social services. 1 senior counselor, social service principal program specialist. Social services program specialist trainee. Any questions on any of these 3? Take a motion.
I can move those.
Yeah, motion by Supervisor King. 4 and 5. Discussion? All in favor?
Aye.
Opposed? Carried. All right, number 6 on the top page 19. Planning Department, keyboard specialist, temporary.
Part-time,
Part-time to fill for vacancy.
I'll move it.
Motion by Supervisor Moore. Any discussion on this one? All in favor?
Aye.
Opposed? Carried. We got 3 positions for highway. More equipment out there full-time. More, 2 more equipment out there full-time, labor seasonal part-time. Any discussion on any of these 3? Oh, 7, 8, 9. Motion by Supervisor Brick at 7, 8, 9.
So the only question that I had when it just came through Public Works was, if I recall, we didn't necessarily have seasonal employees that worked for half a year. Was that the case previously?
Well, I think we provided for like our position, we only got 2 maybe last year.
Okay, but for 26 weeks? This is 26 weeks. I always thought that we did it just for the, I don't know, May or June through September timeframe.
Well, I think that 26 weeks is standard.
Is it for a seasonal?
Yeah, because as soon as the weather breaks, they go right through maybe to November sometimes.
Okay,
It used to be how it's been, new hires, part-timer.
Sure.
A year or 2, they got. Basically,
Yeah.
No, the guy you hired full-time.
I always thought that the laborers that they hired were typically kind of college kids or something,
At one point, they were, but,
They didn't for a while, they didn't hire college kids. Or they're getting the guys that drive snowplow for the state in winter.
yes,
Then they were part-time in the winter, then they go to county highway in the summer.
right.
okay,
And then we do it if they were decent, they were good worker, that train hire full-time. That's all.
Yeah, it's kind of expressed the opportunity to hire some college students if you can't hire anybody,
Sure.
So,
Yeah.
I'm just a comment here, the hourly rates for these individuals with a CDL is considerably lower than what we even pay in our towns for part-time seasonal guys.
that's why we're losing them.
Right. I mean, I don't know if you're gonna find an MEO for $17 an hour with a CDL or for $16 an hour with a CDL. Those are just, shoot, they can go work at Wendy's or McDonald's for $16 an hour,
We raised the pay and he's still having a hard time finding it.
Absolutely. The farms will pay
Right.
$20 or more.
Sure.
Sure. So good luck.
Probably also working from 6 in the morning to midnight.
Well, that's true, but you get paid for those hours, right? It's only short term.
Okay.
All right. Who made the motion?
Brett,
Okay.
motion by Supervisor Brett. No more discussion on 7, 8, 9. All in favor?
Aye.
Opposed? That carries. And top page 20. Yeah. New correction officer, part-time.
I'll move it.
Supervisor May. Both of those. Any discussion on these? All in favor?
Aye.
Opposed? Carried. Reinstate landfill fire safety inspector.
I'll do 12 and 13 if you'd like. Both the same place.
Resume for 12 and 13. Discussion on either one of these. Favor,
Aye.
opposed. Carried. Anything else will come? Finance.
I have a request, but it would have to be for an executive session. And prior to that, I would like to request, since it's almost 11:30, right?
It's 11:15.
11:15, I would request a 10-minute recess prior to coming back and reconvening for executive session, if that's possible.
Just add the sheriff.
There's a meeting, we can move them, that's okay.
Okay, hey, were you supposed to be here for me?
Immediately following finance.
No, we're not done. We're gonna start.
We'll call you.
In 10 minutes, if that's possible. Is that okay?
Dan, are we, for employment history, what's our reason for?
Yes.
Okay.
Is that, so you're gonna need a second.
Second by Supervisor Becker. Favor?
Aye.
Opposed?
10-minute recess?
10-minute recess.
Yeah.
Yes.
So you're gonna do the 10-minute recess now that you're in executive session, or you were gonna do it prior to executive session?
Whatever you want.
Whenever you want. We're not gonna do it
10-minute recess prior to executive.
prior to. Correct.
Aye.
Okay, thank you.
Get that here, you.